Hi, can we start?
Yeah, we are good.
Okay. Good evening, everyone, and welcome to the latest edition of the Hindu's Wellness series. Today, we'll be talking about transformative strategies for brain and mind care. And we have with us a brilliant panel of senior experts from Chennai Buddhi Clinic to talk about neuropsychiatric disorders across the lifespan, from autism, OCD to traumatic brain injuries, Alzheimer's, and dementia. The purpose of the webinar is to sort of discuss how we build a road to holistic and multidisciplinary rehabilitation and look at Buddhi Clinic's model of rehabilitation that blends science with tradition to improve the way we live our lives. I'll start introducing our panelists. We have with us Dr. Ennapadam S. Krishnamurthy, a behavioral neurologist and neuropsychiatrist and the founder of Buddhi Clinic. He has researched on epilepsy, dementia, and the wide spectrum of disorders, and to his credit, has over 70 scientific papers, 25 articles, 30 plus book chapters. He's also an adjunct professor at Manipal University and the Public Health Foundation of India. Welcome, Dr. Krishnamurthy. Then we have Dr. Vivek Mishra, an assistant clinical director at Buddhi Clinic, who specializes in neuromodulation and clinical neuroscience. He did his master's in clinical neuroscience from the University of Madras, and before this, worked as an assistant professor at the Institute of Neurological Sciences, Chennai. Then we have Dr. Rama Raghu. She is the Chief Clinical Officer and General Physician at Buddhi Clinic and has experience of working as a medical officer for over a decade. Her work focuses on integrative therapy programs for neuropsychiatric disorders across the lifespan. Dr. Raghu did her MBBS from Stanley Medical College, Chennai, and proceeded to her MSc in epidemiology from King's College London and London School of Hygiene and Tropical Medicine. A very warm welcome to all of you. It's a pleasure to have you here with us.
Thank
Um,
you.
I hand over the discussion to you, Dr. Krishnamurthy. Please proceed.
Thank you so much. We'll start by sharing screen, and my colleague, Mr. Vivek Mishra, is going to help me with that. So, as we're going to talk about why multidisciplinary and multi-component approaches may be the future of care for the brain and mind. And this is really leveraging on the work that we've done in Buddhi Clinic for over a decade and the model of care that we have developed. Next slide, please. So this is the month where the International Day of Persons with Disabilities falls. And brain and mind disability is a very, very important component of this. We have over 1 billion people with disabilities across the globe, of whom 80% live in developing countries. 317 million children with developmental disabilities and 166 million adolescents with mental health conditions. When you look at people aged 60 years and over, our elderly population, 46% are people with some disability or the other. And neurological disorders are the leading cause of disability, what we call disability adjusted life years. Neurological disorders are estimated to total 276 million disability adjusted life years, and is also a very important cause of death. Mental disorders, on the other hand, 1 in 8 people in this world live with a mental disorder, and anxiety and depression are the most common. And of course, during COVID, there's been a huge 25 to 30% increase in anxiety and major depression just in 1 year between 2020 and 2021. Next slide, please. Now, this is an estimate. The gray bar on the left is infections. And you can see the copper sulfate blue bar on the left is also infection. So all those on the left are in children. And you can see that as a child, infections are a very important cause of disability. As you age, you can see the purple bar, which is stroke, and you can see the pink bar, which is Alzheimer's dementia. And you can see how disability changes from infections in childhood to conditions like strokes and dementia as we age. And if you go to the two pie charts, you will see that migraine is an important cause of disability along with stroke when you're young. But as you get older, strokes and Alzheimer's disease are the most important reasons why people become disabled. This is from the Global Burden of Disease study published in the Lancet. The next slide, please. And here you can see how across the lifespan, people have various mental health conditions. In the red and the orange, right in the middle, are anxiety and depression. And the graph skews to the right, which is it's more prevalent in women. But you can see conditions like schizophrenia start as a young adult and continue through much of life. You can see other mental disorders, so schizophrenia in orange, other mental disorders in yellow, they start and they continue through much of life. Okay. So what this tells you also is conditions like autism, for example, in the green, we think of them as childhood disorders, but please remember, people with autism live with that disability for all their lives. And therefore, that disability also continues through much of life, although their lifespan is slightly shorter. And just to give you a number, between 1990 and 2019, the number of disability adjusted life years due to mental disorders increased from 80.8 million to 125.3 million. So there's a huge jump in the number of people living with these disorders. Now, why are we talking about integration of care or multidisciplinary care? The first is that advances in science are slow and they take time to reach the developing world. The second, and it's very important for us to know this, is that there is a huge gap in treatment in healthcare. Availability, accessibility, affordability, acceptability, and accountability are the reasons why there is a gap in healthcare. People need healthcare, but they are not receiving the healthcare that they need. There are a number of advances in science, like biomarkers for dementia, for example, but they will take a decade to mainstream in the West and a second decade to become available to the rest of the world. So things don't reach the developing world very, very quickly. And in terms of medication, and here I'm using the example of dementia, while there are exciting things happening in dementia treatment, many of those are not going to come to this country that easily because the diagnostics they require are not available. And the costs are so prohibitive that the vast majority of us will not be able to afford it. So we are limited in what we can do. Next slide, please. Integration, on the other hand, taps into one key barrier in healthcare, which is acceptability. It brings to the sufferer treatments that are closer to his or her concept of healing. And what integration of care does, bringing care together, as we will be talking about today in great length, is it reduces suffering. It improves the activities of daily life and it improves quality of life. Dementia is a good example, but the same is true for Parkinson's disease, for stroke, for autism, for a range of disorders where there is disability. And most importantly, in a country like ours, the family is the fulcrum of care, and integration helps the family involve themselves in the caregiving of the individual. Something all of us feel very happy and privileged to do is to look after the elders in our families, and integration allows that, quite unlike a very biomedical system that does not really have room for such involvement. The next slide, please. Multidisciplinary care, often people say, oh, where's the proof that it works? I'm happy to say that there is a lot of emerging proof that multidisciplinary care works. And here's a set of articles published in scientific papers about this. The next slide, please. And of course, we have today, if you take dementia, but this is true for a number of disabling conditions of the brain and mind, including conditions like autism in childhood, there are a range of non-pharmacological approaches that we are able to use. And this range of approaches are now not just discussed, they are being practiced, they're being researched, and they're being published about. And I think that's a very, very excellent development for those of us who are trying to bring in non-pharmacological care. Non-pharmacological means care without medication or beyond medication. Let me put it that way. Next slide, please. And of course, as I was saying, there is a lot of published research. The advantages, as this article has pointed out, are that care is person-centered, non-pharmacological care. It is often culturally salient. For example, we use techniques like reminiscence therapy, where we talk to people about old films, we talk to them about old music, and it's they find it very, very interesting, and therefore it's culturally salient. And of course, it meets the barriers of availability, accessibility, and acceptability. The problem with most non-pharmacological care is that it's time consuming. It is expensive because it requires an expert to spend time. It can be difficult to scale and replicate because each person comes with a different skill set and a skill level. And to normalize that across many people is hard. The proof thus far is soft rather than hard proof. And of course, therefore, affordability and accountability are the two barriers that this care may not always meet. The next slide, please. But what's exciting, and here is a paper from Nature that tells you that when you have non-pharmacological care, there are actual changes in your brain on functional brain imaging. And this tells you, therefore, that non-pharmacological treatments have the potential to bring about physiological changes in your brain. And this is, of course, what we are expecting, what we would like to see, because we believe that we should be able to change outcomes for people beyond medication or beyond surgery. We should be able to change things for people. And this proves that we can actually change things for people. Next slide, please. So, why and maintaining memory or maintaining behavior, whatever medication we have, for example, in dementia, is only marginally effective. And even the most recent medicines are yet to prove their impact. And this is true across the board. If you talk to, for example, patients with autism, there are only symptomatic drugs that we can give them to improve behaviors, for example. There are no disease modifying agents. So this is across the board from childhood to elders. When there is a brain and mind disability, this is true. There's also proof today that if we use an antidepressant or a hypnotic drug for an older person with dementia, you can actually cause more problems rather than help them. So giving older people multiple medicines does actually cause problems, and therefore there is a room to see whether we can approach this in some other way. And of course, there come our non-drug client-centered interventions that we practice in Buddhi Clinic, which we're going to talk about in today's webinar. Neuromodulation, brain stimulation. You hear a lot about this from Vivek. Things like Tai Chi, exercise, and yoga, which are actively practiced. Techniques of cognitive stimulation, caregiver training, various psychological therapies. Really, the list of things that we can do for people is growing. And of course, our multidisciplinary paradigm also includes Ayush, the whole Ayurveda, yoga, and naturopathy paradigm. And we'll talk about that as well. The next slide, please. So our goals, therefore, when we work with our clients, are to maintain activities of daily life and health-related quality of life and improve them to the greatest extent possible. We try to ensure that people can stay with their families. We try to ensure that the families are able to care well for the person that they are looking after. And all of these are extremely important, as we have learned. Family care is more sustainable, and as the West is learning, it's better for the sufferer and the family. Outsourcing care, for example, of an elder to an agency or an old age home may not always be the best thing for them. Although very often, sometimes one is forced to make that decision for very pragmatic reasons. And while modern science is improving and growing by leaps and bounds, we don't believe those solutions will kick in as early as this decade, which means that we really need to have a very wide basket of offerings that we can offer people. The next slide, please. So also to bring in what is locally available and culturally acceptable, to make it seamless and have an element of customer choice, to try and blend modern science with the wisdom of ancient healthcare traditions. Because sometimes what happens when we criticize ancient traditions, it's like throwing the baby out with the bathwater. It's really important to try and see which of those traditions can be harnessed into the care of an individual, and most importantly, to be able to track carefully the outcomes in each person that we are looking after. The next slide, please. There is a lot of proof worldwide, and here is experience from the United States Department of Defense, that about 40% of adults with various neuropsychiatric symptoms studied there were actually receiving complementary and alternative medicine on their own and out of pocket. It's something to remember that the vast majority of everyone under the US Veterans Administration actually gets free care, which means that they were willing to pay for care which was coming to them from external agencies. And this is 40% of people with neuropsychiatric symptoms in the US. And therefore, it's not surprising that our reaching out for such care in India is very, very prevalent. The next slide, please. And of course, we're going to talk today about modern science, and which brings me to why can we not have harmony between traditional systems and modern science? And this is something that we at Buddhi Clinic have strived very hard to develop. And you're going to hear about this from both Vivek Mishra and Dr. Rama Raghu when they share their experience. So I will stop here and I'm going to hand this over. Before I do, let me just talk about our team. In every one of our clinics, we have doctors who prescribe medication like any other clinic. We have various rehabilitators, psychologists, people who do diagnostic techniques, people who stimulate your brain. But we also have physiotherapists, occupational therapists, speech therapists, and holistic physicians, both Ayurveda and naturopathy yoga physicians, and therapy technicians who assist them. So it's about 16 treatments under one roof. And here are the main departments: Ayurveda, yoga, naturopathy, acupressure, acupuncture, and reflexology, physical and occupational therapy, a modern science discipline, psychological therapy, which is also a modern science discipline, neuromodulation, which is a modern science discipline, and of course, we prescribe medication, neuropsychopharmacology. And all of this is used actively in Buddhi Clinic in various permutations and combinations, and the care is personalized to each person seeking it. And now I pass my mic on to Vivek Mishra.
Good evening, everyone. So I will be talking more on how we are revolutionizing the neurological and psychiatric rehabilitation with the use of non-invasive brain stimulation and new neurotechnologies. But we have to start by thinking that brain works in a symphony. So our brain is just like an orchestra with a complex network of 86 billion neurons conducting the music of our thoughts, emotions, and actions. And when this symphony gets out of tune, the neurological and psychiatric condition arises. For example, stroke, depression, Parkinson's disease, and other mood disorders. Though the traditional treatments are available for the disorders, they have their own limitations, such as side effect and limited efficacy can hinder the traditional outcomes. Invasive procedures like brain surgery carry the risk and are not accessible for everyone. So as we discussed that we have to overcome the 5 A's, and one of the ways what we can look for is use the brain's ability of neuroplasticity. The brain is not static, but constantly adapts and changes. Now, this ability to change is called the neuroplasticity. Non-invasive brain stimulation harnesses this neuroplasticity for the therapeutic purposes. And how we are going to use the neuroplasticity with the NIBS or non-invasive brain stimulation toolbox. And there are a range of different modalities what we can use, such as RTMS, uses magnetic pulses to stimulate specific brain regions. There is TDCS, uses weak electrical current to modulate brain activity. TABNS stimulates the vagus nerve, influencing brain networks involved in epilepsy, dysautonomia, etc. Neurofeedback trains the brain to self-regulate its activity, and FMS uses high-intensity magnetic pulses to stimulate the affected nerve or muscle growth. So I will take each one of this in little detail So what is TMS? Stands for transcranial magnetic stimulation. It established as a non-invasive, non-convulsive. There is no seizures involved in this technique, and was initially developed in 1980s, a tool to study human neurophysiology. It was FDA approved for depression since 2008, OCD, chronic pain, and it can be used effectively in other neuropsychiatric conditions like post-stroke rehab, Parkinson's, schizophrenia, etc. So RTMS as a session is a painless outpatient procedure which is non-invasive and require no anesthesia or sedation. Now, transcranial direct current stimulation gently tunes the brain electrical orchestra, as we say. So putting the two electrodes on the head and while stimulating it with the weak electrical impulses of what we look for 1 milliamps to 2 milliamps used to treat depression, anxiety, mild cognitive impairment in elderly, speech and motor symptoms related to conditions like multiple sclerosis, stroke, Parkinson's disease. Also, an effective modality in managing the symptoms in autism spectrum disorder as well as in attention deficit hyperactivity disorder. TDCS, again, it's a painless, non-invasive and well-tolerable across lifespan from 6 years of age to as old as 80 years unless they have other complications. It is very well tolerable. Now, vagus nerve stimulation. The vagus nerve known to be as a body's natural regulator. And what the TAVNS, if we see with this probe, stimulates the auricular branch of the vagus nerve, a key player in the body's stress response system. Now, TAVNS is found to be effective in management of epilepsy, vertigo, cluster headache, dysautonomia, and regulating the gut-brain axis. And all these procedures are typically a session lasts from 20 to 30 minutes for TAVNS. Now, coming to training the brain to itself is the neurofeedback. A QEEG guided neurofeedback therapy monitors your brain for brain activity and almost immediately provides a feedback, often through the visual or audio cues. So if we can see the maps, brain map on the right hand side, that how the brain is getting activated on the regions we are applying the probe on when the person uses that particular brain area. Using this technique has been shown to be improvements in treatment disorders like ADHD, anxiety, depression, autism spectrum disorder, insomnia, even in cases of drug addiction, schizophrenia, and learning disability. So we are stimulating the brain and we try to train the brain. But what about our body? The functional magnetic stimulation, also known as the peripheral magnetic stimulation, modulates the nerve muscle groups to relieve the pain and enhance recovery. In conditions like spinal cord injury, frozen shoulders, upper or lower back pain, musculoskeletal symptoms like tendonitis, fibromyalgia, the complex regional pain syndrome or pain of unknown origin, neuropathies, and in some cases of urinary incontinence resulting from the injury. And all this can be achieved by stimulating the periphery or the upper or lower limbs or the back with the help of a coil which induces the high intensity magnetic pulses. And everyone talks like the evidence is the success story about whether we are using the TDCS in for cognition in elderly. We look for in the learning and increase regional multiple brain regions to stimulate. We look for TMS for depression and OCD, and even in the neuro rehabilitation for after stroke. To just give you a snapshot where when like in any standard care model, a person undergoes an assessment at the baseline. And if we monitor the progress they are making, and we see at the baseline after 10 sessions, after 20 sessions, and even after 8 weeks, and we see there is a significant reduction in their depression scores. So these are from the Beck's depression inventory, and we see the scores remain stable even after 2 months. If we talk about an example of Parkinson's, So one of the gold standard tool to measure the symptoms of Parkinson's is Unified Parkinson's Disease Rating Scale. And again, if we look at the baseline before they start treatment at 10th session and at 20th session, there is a significant improvement in their symptoms. And are we talking about just the symptoms? No, it's not just the mobility. So it also impacts on the speech and language pathology assessments, where speech is being found improved, drooling is reduced, sleep improves, cognition, which what we rated on the Montreal Cognitive Assessment, pre-test, post-test improve, so as the symptoms of on neuropsychiatric inventory. And as one of our 72-year-old patient who have taken the TMS puts, that my hand was never so steady, nor I was able to concentrate on task in my last 10 years since she got the diagnosis at the age of 62, what she can do now post TMS. And this is also evident when we look for the WHO quality of life score, that not just the physical, but there is an improvement in psychological functioning, there is an improvement in social, and the environmental functions also improves. Again, when we look more of a combined data, when we put use of TDCS with the holistic care, and this is what we found, that over 73% of the patient have shown improvement on their mini mental state examination targeted at the memory. So as if we look on the right side, the shaded graphs are the symptoms which they have shown positively correlated, which got improved. So the interventions not only results in better memory, but also in better mood. And what we can put that the era of a non-invasive brain stimulation is by understanding the underpinning of the brain and mind disorders, we can target specific brain region, enhance the recovery even in intractable cases. Recovery is multifold, with adjunct with integrative therapy approaches of such as composers of clinical psychology, physiotherapy, holistic care, and optimized pharmacotherapy. And to have a case based on these integrated approach, I would like to invite Dr. Raman to present the case.
Good evening. Integrative care essentially comprises of comprehensive evaluations followed by a multidisciplinary treatment program. So this seamlessly integrates cutting-edge technological interventions along with conservative treatments, which include Ayurveda, naturopathy, and yoga treatments. So you can see we are focusing on problems of memory, mobility, and mind across the lifespan. Next slide. So to deliver integrative care, we have a very experienced, well-trained and proficient team under the allopathic umbrella. And you can see that we have experts from all the labs who help deliver this kind of care, including evaluation and treatment. And the treatment is multidisciplinary. Here, the team works in an interdisciplinary way. They work with each other, simultaneously working with the patient and the caregiver and the family. So to illustrate the integrative care paradigm, I will be discussing the case of a 70-year-old clerk who came to us with his family from Pondicherry. And his symptoms date back to 5 years ago, where it started with severe tremors of the right upper limb and lower limbs and some tremors of the left hand. There was a lot of stiffness of the right shoulder with restricted movement and pain in the neck in the upper and lower back. And he felt giddy when he used to walk, and he had severe fear of falling down, and he required to hold his spouse's hand while walking. There was a lot of anxiety around these symptoms, which also caused palpitations on and off. There was a frequency of urination with very poorly controlled sugars. He was dependent partially on his wife for many activities of daily living. There was an increased appetite and sudden hunger pangs in the morning between 2 and 3 a.m. when he used to get up. It used to fragment his sleep, and it also resulted in poor glycemic control because he needed to eat at that time of the night. There were no other sleep behaviors. And he was also on treatment for diabetes, for hypertension, and coronary artery disease. And he had had an angioplasty around 13 years ago. So the primary clinical features in this patient were the Parkinson's features, and there was a lot of spasm and pain. He had difficulty in walking with imbalance. He had numbness of the feet. He had a lot of fear of falling down because of the giddiness and his other symptoms. And there was a lot of anxiety and irritability. So if you look at the multidisciplinary approach that we have to assessment, which is really important because it helps us glean a lot of information that we put together to form our treatment programs. We also exclude treatments which are not suitable for the patient. We look very carefully at the contraindications and any treatment which has not helped the patient in the past. So if you look at the various domains that are put down, so in the physical domain, we've looked at the pain score, which is the visual analog score, VAS. And then we've looked at how he's scored on the disability. And we have the Parkinson's rating scale, which looks at mentation, behavior, his activities of daily living and his motor examination. And we look at how independent a person is in his activities of daily living. And we also stage the Parkinson's. And in the electrophysiology, we look at the EEG, and we also did the nerve conduction study because of his complaints of numbness. We also did the MRI for the imaging findings. And if you look at the cognitive domain, we looked at the cognition and the mood, and we looked at the neuropsychiatric symptoms, which were quite significant in this patient. And from the holistic perspective, we have the holistic physicians, the Ayurveda and naturopathy doctors also doing their assessments, where they look at the constitution, they look at the nerve ring in the iris, and they found that there were problems in the motor area. And on the whole, we look at a score called the clinical global impression, where we look at the complete overall clinical status and where this patient was severely ill. So based on this comprehensive evaluation, we had a diagnosis of Parkinson's disease with clinical dysautonomia and anxiety with all his comorbidities. And he was admitted in hospital because of his various symptoms with various degrees of severity and very poor controlled sugars. So he came into hospital. He was there for a week. And we began the multidisciplinary therapy program, which we based on this assessment, which I will be talking to you about. And as I mentioned, the umbrella is allopathic. So the medications go hand in hand with the therapy program. And when he completed the hospital treatments, he continued the treatments as outpatient at our clinic. Next slide. So here you can see all the medication that he's on. It's quite a bit, but as I mentioned, he had a lot of comorbidities and he required these medicines. We also gave him some supplements based on the blood work that we did. And the medications for his neurological problems were for Parkinson's, for anxiety, and for sleep. So coming to the intensive integrative program, we did 5 hours of psychotherapy, which included cognitive behavior therapy for his anxiety, relaxation exercises, and we spoke a lot to his wife, who was the primary caregiver who stayed with him, as they were from Pondicherry. And she was also undergoing a lot of caregiver distress because of the dependence that he had on her for his activities of daily living. And the neuromodulation, we did the TDCS, which focused on Parkinson's, on the motor points. He underwent 20 sessions. In the physiotherapy, we did manual treatments to relieve the spasm and rigidity, which were very painful. We also did electrotherapy for that, and he underwent a comprehensive exercise protocol, as well as some mobility workouts in the rehab gym at the center. In the holistic therapy domain, we did 15 hours of a combination of Ayurveda and naturopathy treatments, Shiro Abhyangam, Podikiri, reflexology, and mud pack. So this is our rehab gym, which is very elder safe and which is completely supervised. The sessions are supervised by the physiotherapist, and you can see there are special safety features such as the harness when they use the treadmill. And he underwent gait and balance training and some fine motor activities and mobility workouts as well. So coming to the complementary and alternative medical treatments, which are the holistic treatments. So Shiro Abhyangam is an Ayurveda treatment where we massage the head with warm medicated oils such as Shira Bala. It helps reduce the anxiety, improves quality of sleep, and makes the person calm. And Podikiri is a treatment where we use poultices, and we do hot foment with these poultices, especially on the limbs and the back, where there's a lot of stiffness and rigidity for patients with Parkinson's. And reflexology and mudpack are naturopathy treatments. In reflexology, we do circular massages in the palms and the soles. And here we are able to unblock the energy channels, which help improve the physical and mental well-being. And the mud pack is especially beneficial for patients, especially elderly patients, because it improves gut health. And here we apply a paste of mud on the abdomen and keep it there for 20 minutes. So this helps improve the blood circulation to the abdominal organs. So it improves appetite and reduces constipation and reduces acid reflux as well. So after 5 weeks of treatment, which was a combination of treatment at hospital and at the clinic, and this included 50 therapy hours. If you look at the outcome measures, qualitatively, there was reduced pain and spasm in the muscles. And if you look at the Parkinson's features, again, there was reduced rigidity, the tremors had come down and his balance had improved. Behavior and cognition, the moods had improved dramatically and the anxiety had subsided. Cognition was preserved. If you look at the systemic symptoms, the sugar control had become very good and hence he was able to sleep. So the nighttime behaviors of getting up in the middle of the night and eating food was not there. And if you look at the overall disability, he had become independent in his activities of daily living at the end of 5 weeks. The disability had reduced from 54 to 38%. And when we look at the overall clinical improvement, it was marked. So this is the quantitative measurement as against the qualitative measurement of the scales. So the first is the Parkinson scale, where the score has come down from 40 to 24 at a significant improvement. The visual analog scale scores the pain. It was 5 out of 10 and now it is 1. And the disability score had dropped from 54 to 39%. The balance had improved from 48 to 54 and the cognition was preserved in the beginning and it remained there at 96. If you look at the psychiatric symptoms, the irritability and agitation had gone away. Irritation was mild, agitation, anger had subsided, and the appetite had normalized. So the case learnings here are, I think the best way to approach a patient is doing a comprehensive assessment so that we are able to understand the patient and understand his problems completely. And this helps us to formulate a multidisciplinary program. And as I said, it's multi and interdisciplinary work that goes on within the team and with the caregiver and the family and the patient. And like I said, we talk a lot to the caregivers to understand their challenges to help them make the patient better. It's a combination of allopathy with a lot of treatments that are available, and we keep adding newer treatments as we come to know of them. And if we know that they will help our patients, and the assessment and evaluation is very robust. So we do the periodic evaluations to understand the progress, and this helps us tweak medications and treatment as we do the treatments. And all the interventions are conveniently available under one roof at the clinic. And most of the treatments also go home and to the hospital. And importantly, the program takeaways such as exercises and the physiotherapy exercises, relaxation exercises, and yoga can be learned by the patient and can be practiced at home independently or with the help of the family and the caregivers. So it is really never too late to wake up to the possibilities that integrative therapy has to offer in terms of both a comprehensive evaluation and in terms of treatment, and the treatments that are possible beyond medication for a lot of chronic disorders which are disabling and which are degenerative. So this coming back to the patient journey of this patient who had a very disabling neurological disorder, where we integrated the best of medications with treatments and based it out of the appropriate places. So a year after he finished his treatment with us, he's been regularly reviewing, he's been practicing his exercises, and he's maintaining all the gains and improvements that he got from the therapy program. Thank you.
Thank you. So that was an elder with a neurological disease, Parkinson's disease. Now, just briefly, a case vignette of a young person with not just mental health symptoms, but undiagnosed and untreated neurocognitive disorders, which often affect young people. Next slide, please. So this is a technologist working with machine learning and artificial intelligence at a fairly high level. He had been diagnosed and treated as a mixed mood disorder for 2 years without any significant symptom reduction. And he presented to us with low energy and inability to focus, poor social interaction, poor sleep hygiene, and all this was leading to absenteeism from college and the workplace and very poor functioning on the whole. And in our comprehensive assessment, we diagnosed him to have attention deficit and hyperactivity disorder, the adult variant, which had previously gone undiagnosed and untreated, together with a pre-existing mood and anxiety disorder. And you can see here how an online cognitive assessment, which we use, an American protocol called CNS Vital Signs, which people can actually do from the convenience of their own homes on their computer. It shows you how his overall neurocognition index was very low, as were a few other parameters like verbal memory, complex attention, cognitive flexibility, executive function, and composite memory was low, and some other things like visual memory and reaction time were low average. So we get this kind of a profile when we do these tests. And we've measured his depression score, his anxiety score, and his overall disablement in our evaluation. So he got 20 sessions of neurofeedback for attention and cognitive function. He worked with our physiotherapist for pain and cervical spasm. He had cognitive behavior therapy and Jacobson's relaxation exercises. And as Dr. Rama has been describing, we have a holistic care paradigm for people with mental health conditions, which includes things like Shirobhyangam and mud packs, and reflexology, which actually gets them a lot better. And you can see here the outcomes in neurofeedback, which are very objective. The target score is 2 for an adult. And you can see he started off with 0.91 and he is finished now on 2.2. And needless to say, the young man is much, much better. Of course, he's also receiving pharmacotherapy, but he's much, much better in terms of his attention and concentration, his ability to work, as well as his mood and anxiety. And that's a much more holistic improvement for this young person. And we thought we should highlight that aspect also to you. The next slide, please. So, when we do this kind of integration, what does it achieve? The first is that it addresses individual client needs, because not all treatments suit all patients. It also addresses the client's belief systems and preferences, because any one of us staying engaged in a form of care that takes a few weeks requires that we actually prefer to do it and we believe in it. This is extremely important. And here the family becomes very important, because very often people with brain and mind disability may not have the motivation to adhere to treatment. It brings in an element of patient choice. We have 16 treatments. We use 3 or 4 for the average person. So we do allow our patients to choose. I actually wrote a piece on LinkedIn called The McDonald's of Healthcare. Because basically, I think what we like about going to a place like McDonald's is choice. And choice is a very important element of healthcare, which we believe needs to be brought in. It's personalized. So each person is treated for what they need. And of course, I think to a very large extent, it breaches the 5-way barrier. And in fact, our most recent innovation is a platform called Buddhi Online, which we invite you to check out, which is now addressing the affordability dimension for those who cannot come and take treatment in clinic. The next slide, please. So what we have in Buddhi really represents the future of neuropsychiatric care. And it is here. And like many wonderful healthcare innovations, it is happening from Chennai. And I'm so happy that Chennai is the place where this too has started. It's a model integrated therapy program for neuropsychiatric disorders across the lifespan. We have seen very promising trends. We've treated a very large number of patients. Our database today is over 13,000 patients who have gone through various interventions. It goes beyond medication to address physical therapy, psychological care, and leverages on the best of modern science and the wisdom of ancient healthcare traditions, both of which we believe are equally important. And very interestingly, the data that we have published recently at the Asian Society Against Dementia in Bandung, it actually showed us that independently, both brain stimulation like TDCS and Ayurveda naturopathy combos of the kind that we practice bring about very similar improvements for patients. So the number of options we have are many, many, and I believe that all this has great potential as part of a healthcare paradigm for the brain and mind. And of course, as I've tried to highlight to you, non-pharmacological treatment is an area of great interest today across societies, as is a holistic approach. And our model, which is process driven, we have an electronic medical record, we score all symptoms. We believe this is a scalable model with global potential, and we hope to start by having Buddhi clinics in various other parts of India very, very soon. So it's really a watch this space moment. I hope you found this interesting, and I hope you learned a little bit about how a number of approaches brought together seamlessly can actually make a difference to people having brain and mind issues. Thank you so much.
Most definitely. Thank you so much, doctors, for the very insightful presentation and highlighting the gap in neuropsychiatric care right now and the urgent need for innovation, of course. I encourage participants to please put in their questions in the box. One thing I would like to start with is we spoke about the burden of anxiety and depression, and there are some people in the chat box asking about not being able to recall words or the stress due to information overload, the memory deficit everyone is going through. At what point does someone need medical attention? At what point should they seek care? And another question related to this is something like TDCS or TAVNS a good treatment for this?
I'll take the first one, and then I'll let Vivek talk about TDCS and TAVNS. Effectively, young people with cognitive issues very often have depression as the primary cause. And this is coming out of research in epilepsy, research in strokes, research in a number of conditions, that you present with what you think is a cognitive problem, but you really are depressed. So yes, depression is associated with neurocognitive symptoms in a very big way. And those neurocognitive symptoms need to be addressed. Now, as the little case that I illustrated, highlighted to you, sometimes you can have undiagnosed neurocognitive problems as well. So this is a person who's gone on to do a master's, is working at a fairly high level, but had ADHD that was undiagnosed. And I think this, therefore, also people need to be aware of that if you have intractable symptoms that are not getting better, mental health symptoms that are not getting better, one must look for hidden causes, physiological causes. That is one. And secondly, if you do have neurocognitive symptoms, please do not ignore them. They actually need to be properly evaluated, because they may need a slightly different approach from the treatment of depression itself.
Right, that's
TDCS and TAVNS for neurocognitive symptoms.
So when we talk about the TDCS in particular, which is the transcranial direct current stimulation, is stimulating certain brain regions such as the prefrontal cortex, improves the executive functioning, and as one among the executive functioning, our cognition, sustained attention is the area which comes from the prefrontal cortex. So we can stimulate it on a regular frequencies, and it's very minimal. It's just like 2 milliamps of electric stimulation. It's not like the ECT is what we see in the movies, that person is getting shocked. It is nothing like that. It is a very gentle modality which used to stimulate the brain even at the bedside or even at home.
If I can add something there, many people with depression have physiological symptoms, depression and anxiety, and some of these come from a part of your nervous system called the autonomic nervous system. Because chronic anxiety triggers dysautonomia, an imbalance in the autonomic nervous system. And that is precisely where VNS actually is very, very helpful. It's a very good treatment to stabilize the autonomic nervous system. And many of these people have unexplained medical symptoms. So the doctors tell them, oh, there's nothing wrong with your heart. There's nothing wrong with your gut. There's nothing wrong with this or that. And you're wondering, why am I feeling so ill and I'm having so many symptoms? And that is due to an autonomic nervous system that's imbalanced. Transcutaneous auricular vagus nerve stimulation is actually an excellent treatment for dysautonomia. And the number of success stories of people we have who come to us, especially post-COVID, because both COVID and vaccination for COVID triggered dysautonomia for a number of people. And so that's where VNS becomes very useful when you have depression and anxiety with comorbid dysautonomia or comorbid symptoms of that nature.
Right. Okay. One question we have from Dr. Subramanian Sundaram is when it comes to neuromodulation in treating neurological ailments, what are the barriers in daily clinical practice and where is the research level currently at?
So, there are the safety screening questionnaires which have to be administered at start of the session. So, for example, if we are treating using the TMS, the transcranial magnetic stimulation, and a person have a brain implant or having a cardiac implant like a pacemakers, so those people are excluded from the treatment paradigm because we can't stimulate them. So there are some people who have a very high threshold, which exclude them from the studies. But if we are looking, there are about 80% to 85% of the people are fit for the treatment. So when we talk about the TAVNS, the vagus nerve stimulation, so their ECG have to be cleared by their family physician or a cardiologist. So those are the medical side what we look for, that what we have to screen them first. Apart from this, I think they are very safe and they are very tolerable. Everything is an outpatient unit. So, and all the modalities, it can range from 20 minutes to 55-minute protocols, and still the patient can go drive their own vehicle back to home. So I think they are very well tolerable.
I think Dr. Subramaniam, who asked the question, is very correct in asking it because patient choice is extremely important. These are not to be done randomly by people without careful patient selection. As Vivek was pointing out, there are contraindications, and one needs to be very careful in making sure that you're not including somebody with contraindications into the treatment programs. So I think with good planning and in good hands with thorough evaluations, these treatments have great potential, but they're not meant to be. It's not DIY stuff, definitely.
Right, that's a very good disclaimer actually. One thing about diagnosis and vulnerability is dementia, something like dementia hereditary? Is there a genetic factor if people should take into account and kind of seek early treatment?
So just to answer that, I think there is a proportion of dementia, 10 to 15%, especially of Alzheimer's disease, but also frontotemporal dementia, which can be hereditary, and also dementia associated with Parkinson's disease. So it can be hereditary. If you have a family history, especially if you have a direct relative, like a parent affected, or if you have more than one person in your family affected, it's very, very important to be aware of the genetic possibilities. It's very important to include a memory test as part of your annual health checks. Properly done memory test is actually adequate most of the time in order to decide whether one is doing okay or not. And these memory tests, like Vivek talked about the MOCA and the mini mental state examination, none of these tests take very, very long. They are fairly quick, can be done in about 10, 15 minutes with somebody who's trained to do them. In fact, Dr. Rama has been doing a whole study of various instruments which are being used across Asia to look at memory. And all these tools are very, very user-friendly. But yes, so you would be well advised to have yourself checked periodically, like you check your sugar or like you check your cholesterol. If you have a family history, do check your memory as well periodically.
Right. We have one question from Vidya P. Her mother is aged 50 years and has acute ischemic stroke last year. She has numbness in her right upper and lower limb. They've been following medications for the last 1 year, but there's been no recovery. She still has that numbness. What kind of treatment should she require? Yeah, to either of you.
Take that.
Yeah, so for stroke, we do a complete evaluation. So if the person is bedbound, we could, if she is in Chennai, we could go home and do the evaluation. And if she is in another place, we also do online evaluation. So that gives us the information. Since it's a year old, we will also look at some neuromodulation for her for stroke. It could be a TDCS, which goes to the doorstep. It can be done. And we also integrate physiotherapy, which they could be doing. But I think if we look at the assessments more carefully, there are certain things that we can do well in terms of improving the strength of the limbs and mobilization and things like that. And the others are the holistic treatments which come in, the Ayurveda and Naturopathy treatments, which will be advised by the holistic physicians. So all of these can actually go home. So if they are here, it is easy. If they can come to the center, also well and good. We can also move them to the rehab gym. There are things if she is able to do that. But all the stimulation and in terms of the physiotherapy, where we have electrotherapy, the exercises, the holistic treatments, and the neuromodulation all will come together to make her better. But this is from the information that we have got from her message. But if we see her, I think we will have a better picture of what we need to do in terms of a treatment program.
Thank you for that. We're almost out of time, so very sorry we can't take all of the questions, but also two more. One repeated question we're getting is regarding the cost of treatment. So what kind of affordability factors should we keep in mind, and what is the range people want to know?
So I think the thing to know is that treatment is very personalized, and therefore it's very hard to put a flat cost on a person's treatment. The other thing to keep in mind is that treatment is, as Dr. Rama was explaining, for example, about the stroke person or the Parkinson's person whom she presented. Treatment is very intensive. So it's about 50 to 60 hours of work. And therefore, that is what really, it's manpower cost really more than anything else when it comes to rehabilitation. This is the truth. The cost is the cost of having a specialist work with you one-to-one for 50 to 60 hours, different kinds of specialists. That's really cost. The range can be very, very wide. Some of our patients can be as low as 25 to 30,000 rupees for a course of treatment. It depends on the kind of treatments they're getting. It can go to much, much higher than that, depending on the intensity and the number of hours of work that has to be put in. So it's best discussed on a case-by-case basis rather than try to sort of generalize it.
Right. And as you mentioned, the website as well, Buddhi Online can probably be a right venue for this.
For those people who have cost issues or who can't come to clinic, Buddhi Online is actually a very useful care paradigm. We have about 50 plus instructional videos, and we have the same method that we use in clinic is being used, where a whole team meets the person, they do an assessment, and they come and guide you as to what you need to do yourself. And we also send people kits with instructions that they can use to treat themselves. So it's a very comprehensive program, and I would definitely recommend people to check it out.
Right. And one last question, sir, would be, is there any when it comes to Parkinson's disease, is there any test to be included in the annual health checkup? Should someone be actively seeking their one diagnostic test?
So again, if you have a family history or if you're having new symptoms, which are like tremors or rigidity or slowness. I mean, one way to notice slowness is if you're walking in an airport and everybody else is walking faster than you. And that's not happened before. That's actually a very good indication that you're probably slowing down, right? So in those circumstances, yes, but that is just a good neurological examination. The best way to get that done is to actually meet a neurologist in your locality and have him or her examine you for whatever you're concerned about. It's a clinical evaluation. It's difficult to do a test. The do-it-yourself test is what people do in temples, which is they try to put one foot in front of the other and walk with the feet touching each other. In Tamil, we say Adi Pradakshina. That can be a good test of balance for someone to do it themselves. If you're worried about your balance, don't do it near a wall because you don't want to fall the first time you try it. But yeah, that's a do-it-yourself balance test, if that's helpful.
Thank you. Thank you so much for your answers and for your questions. We're really sorry we can't take all of the questions, but we'll be sure to reply to the ones, as many as we can. Thank you to participants for joining the Hindus Wellness Seminar presented by Buddhi Clinic. Now we have a short video, and I request the Hindu events team to please play that.
Can we also say while we are waiting?
Sorry, sir, you've been muted.
While we're waiting, those with queries can just email care@buddhiclinic.com. And we will be very happy to answer those email queries as well.
Just to note, the email ID is also in the chat box if anyone wants to copy that. Thank you. The Hindu events team, is the video playing, please?
You want to take one more question while we're waiting?
Sure.
Someone's asked about preventing Parkinson's and Alzheimer's. Maybe I'll just talk
Sure.
about that very briefly. I think preventing neurodegeneration is all those things doctors tell their patients and don't do themselves. Walk 10,000 steps a day is something that today across the board we know is very helpful, both cardiovascular health and brain health. So if you have a step counter or a smartwatch, please do walk 10,000 steps a day. That's very simple, easy to do. The second thing to do, obviously, is to continue to learn new things right through life. Very often, what happens is that they stop learning new things as they get older. Learning new things, not just mental skills or cognitive skills or languages or, say, Sudoku or chess or whatever, but also learning new things as in, motor things, doing things which you have not done before, but of course with supervision, is very good for the brain. So learning new things, a healthy diet, very rich in fruit, vegetables, and legumes is highly recommended. And this is something that one would strongly ask everyone to look at. Meat is to be used a little bit sparingly. Fish can be used often, but chicken or red meat twice a week is about the average that's recommended. You'll find a lot out there about red wine, but that's with moderation. It's not meant to be obviously drunk in large quantities. The other point to keep in mind, of course, is that all those red wine studies are done in the Mediterranean region where everybody spends a lot of time socializing. So, which brings me therefore to the fifth point, that please socialize, meet new people, do new things. And this is a very good way to keep your brain functioning well. I hope I've at least in part answered that question.
Thank you. I think a good diet, friends, family, walking it's the answer to a lot of things. I think the team is having an issue, a technical glitch. Could you play, sir? Could you please play the video from your end if possible? The video, would that be possible? Yeah.
So this is an introductory video about Buddhi Clinic, which just tells you a few things that we do, and you get some visuals. We'll just try and see if we can play it. We were not expecting to have to do that, but yeah.
No worries if not. If not, that's completely fine. There are questions if the slides and the information is available on the Buddhi Connect portal, which it is, like Sir mentioned. So you can all go and explore that and the videos as well for some self-information.
Yeah, I will. Yeah. This is wheat. Options. Yeah. Position.
It's working. Let's go.
Yeah,
Sorry, are you seeing the screen?
No, sorry, it's not visible.
Yeah.
Now it is. Now it is.
Thank you. Sorry about that.
Welcome to a brand new state-of-the-art brain and mind care facility here in Chennai. Brain stimulation.
I think we've lost the audio.
Is one that affects the brain and mind interface. And when we say brain, we know we have an organ there. But when we say mind, we touch our hearts, we touch our heads. The mind is really just the software in our brain, the millions of nerves talking to each other through chemicals. What do we have in our armamentarium to treat these patients? We have surgery for some, medication for many, if not most. But beyond all that, what do we have? And what we do have is rehabilitation, therapy, and care. Now, usually a person with a neuropsychiatric condition will have to go to various places in order to receive these treatments. Imagine if you could get all of them under one roof. Imagine if you could just by traversing floors meet experts in every one of these disciplines who are programmed, prepared, and equipped and qualified to help you. And that really is what we offer you here at Buddhi Clinic. The opportunity of blending modern science and ancient wisdom, the opportunity of being able to receive the very wide array of care treatments that can help you. So do come, visit, see what we have on offer, and I'm sure you will not be disappointed. In fact, I'm sure you'll be exhilarated by what you're seeing. Thank you.
The basement houses the state-of-art neuromodulation facility. We have repetitive transcranial magnetic stimulation, transcranial electrical stimulation, which comprises of PDCS, PSES, pulse, and random noise stimulation. We have transauricular vagus nerve stimulation. Along with the neuromodulation, we have yoga and mindful suite, as well as the mind labs, where we are following the traditional as well as the modern way using the computerized models of assessment and therapy.
Welcome to the Neurodiagnostics Lab. So this suite is well equipped to run all our electrophysiological assessments. So here we do the EEG, the nerve conduction studies. We also run the autonomic tests. And here you can see the tilt table, which is used to do part of the autonomic testing. This suite also has a state-of-the-art sleep lab. It's a very comfortable space where patients with sleep disorders have an overnight polysomnography, that is the sleep study. So you can see that this is a suite which is very well equipped to run all the neurodiagnostic tests for patients with neuropsychiatric disorders across the lifespan. Welcome to our advanced gym facility on the rehab floor. Here we have equipment which is customized to address physical disability for patients with Parkinson's disease, stroke, or traumatic brain injuries, and various other neurological disorders which cause a lot of distressing physical disabilities. These are our mobility lab suites, part of the rehab flow. And here are well-trained and expert physical therapists deliver interventions such as electrotherapy, manual therapy, and exercise therapy for patients with pain, balance and posture issues, and autonomic symptoms, among various other physical symptoms of neurological disorders. This is our Dr. Deepa Krishnan Neurodevelopmental Therapy Suite. And here are physical therapists work with children with neurodevelopmental delays. On the rehab floor, we have the speech and language therapy suite, where our speech and language pathologist delivers speech interventions and swallowing maneuvers to children, adults, and elders with speech and swallowing disorders. The second floor is dedicated to holistic care. So we have the complementary and alternative medical treatments. So here we have 2 dry therapy suites where we do acupressure, reflexology, and meditate massage. And here we have 3 wet therapy suites where we do treatments with medicated oils, powders, with foments, and we use mud packs, after which the patient can go across to the bathroom and have a bath. And these treatments are used for a host of physical, cognitive, and behavioral symptoms, which are very common in neuropsychiatric disorders.
Thank you so much for this. Just a reminder, if anyone wants to reach out to the Buddhi team, mail ID is in the chat box. Thank you everyone for your time. Have a good evening.
Thank you so much.
Thank you.
Bye-bye.